Hello, my name is Jessica Dixon, and I'm presenting my research with Alina Stimmel and Dr. Aaron Wilbur on spatial disorientation in Alzheimer's disease. Getting lost is one of the first symptoms of Alzheimer's disease. So if we understand the brain changes associated with getting lost, that may lead to the development of earlier Alzheimer's disease diagnosis methods and treatments. Previous work in our lab has found that female 6-month 3xTG80 mice, which are genetically altered to model human Alzheimer's disease, are impaired at navigation, similar to what we see in humans. We focused on the cerebellum, the parietal cortex, and the CA1 region of the hippocampus because this is a brain network that is associated with navigation and that we have previously found to be dysfunctional in the 3xTG-AD mice. Previous literature has suggested that there is a relationship between neuronal hyperactivity and the presence of amyloid beta in preclinical Alzheimer's disease. However, what remains unknown is whether this hyperactivity is compensatory or pathological. We begin to answer this question by looking at task-induced activation. We used a linear track navigation task in which the mice are placed in a start box, which is moved a random distance away from the goal zone. When they are released from the start box, they have to use the landmarks around the room to navigate to an unmarked goal zone where they have to pause for a certain amount of time in order to receive an electrical stimulation reward. 90 minutes after the last task, we euthanize the mice and then process their brain tissue for CFOS, which shows the neurons that fired during the navigation task, and DAPI, which shows the nuclei of the neurons. We look at the overlap between the CFOS positive markers and the DAPI, and then compare this to the total area of the brain region in order to quantify activation. What we see is that the AD mice are impaired at navigation with the 1.5 second delay task as they have increased velocity as they enter the reward zone, showing that they don't recognize the reward zone as well as the control mice. There aren't enough control mice in order to make a significant comparison, but our preliminary data does suggest that there's higher levels of activation of the parietal cortex in AD mice. And we do see a significant relationship between the activity of the parietal cortex of the AD mice and behavioral impairment. We essentially see that AD mice are impaired at navigation, similar to what we found previously in the lab and in humans, and that there's a greater amount of activation in the parietal cortex associated with behavioral impairment in 3xTG80 mice, suggesting that this mechanism is not compensatory and is most likely due to Alzheimer's disease pathology, something that we are investigating in our future work.